Hi, Dr. Westman here with another Dr. Westman Reacts. And this video I'm reacting to is about insulin resistance and low carbohydrate diets. I think it says that low carb diets cause insulin resistance when I see that improve in my practice all the time. So let's see what they have to say.
So there seems to be a connection between insulin resistance and a lot of health conditions, but let's just take a step back here and define what exactly is insulin resistance and how does it develop?
Okay, insulin resistance means that the cells that are supposed to be responding to insulin aren't responding.
So I just want to pause here a moment. I know Dr. Neil Barnard. He is a physician who is founder of the Physicians Committee for Responsible Medicine, I think it's called. It's based in Washington, D.C., and he's done some research on diets. Usually, well, it's pretty much always the diet that he expounds or is famous for, which is more of it's very plant-based and maybe even vegan. I'm not quite sure. But so Dr. Barnard, we've been on the same podium. So we've actually, I've met him and conversed through the years. And so I see him as an expert in plant-based diets. So it's curious that he's commenting on low-carb diets, which is I'm an expert of, but let's see what Dr.
Insulin
Barnard
is,
says.
of course, a hormone that is made in the pancreas, and it acts like a key. So when it arrives at the surface of a muscle cell, it actually attaches to an insulin receptor, just like a key in a lock, and that opens up the cell membrane to let glucose come inside. So if a person has type 2 diabetes, normally the glucose should be able to be escorted into the cell by insulin, but the cell is just not responding to that insulin very well at all. And up until comparatively recently, people reacted by saying, okay, don't eat so much sugar, don't eat carbohydrates that will release more sugar into the blood because you're insulin resistant, you can't handle it.
Well, and that's what I recommend, is that you don't put so much sugar and starches into the body. And it was the treatment for diabetes 100 years ago, actually, before there were medications. I guess I'm part of what he's thinking doesn't work anymore, but let's keep going.
Our response is different. Our response is to say, wait a minute, your cells are supposed to work with glucose. They should be able to take glucose out of the blood. Let's tackle the insulin resistance. Let's fix that if we can.
So I see. So in the 1950s, 1960s, what happened was there was a shift from treating diabetes with just food alone. The blood insulin was able to be measured, and they found the insulin was high in the blood in people with type 2 diabetes. So the thinking was, well, there's insulin, but it's not working right, so we'll call that insulin resistance, and there must be something wrong inside the cell. Of course, what was forgotten is that by not eating carbohydrate, by telling people not to eat carbohydrate, it fixed the entire problem because you weren't having to process so many carbohydrates. So there was a shift from the idea that not eating carbs was a great thing for diabetes to the idea that it was a problem inside the cell. Like it's got to be something wrong with that cell because what you eat doesn't matter. Well, it actually did, but it's just a shift in focus.
So that raises the question of why. And we can see why. You stick the patient into an MR machine, magnetic resonance spectroscopy, and looking into the muscle and liver cells, what you discover is they're filled with microscopic fat particles. That's stopping insulin from working. So to make it short and sweet, if I can get accumulated fat out of the muscle cells will respond to insulin again, and the sugar can get into the cell and out of the blood, and my diabetes should get better or even go away if it's time.
Well, I totally agree. You want to reduce the fat inside the cell, and you can do that by cutting out carbohydrates. People have lower blood sugars, and they're not turning the sugar into fat. They're not exporting the fat from the fatty liver to the cells. So I guess I've agreed so far.
Type 2. If I've got type 1, the same thing will occur, except I can greatly reduce my insulin need, but I'm not going to completely eliminate the need for taking some insulin.
Okay, so this is actually super helpful because you're also a master of teasing apart the difference between sort of the long-term difference between low carbohydrate diets versus low fat diets. So can you talk a little bit about how a low carbohydrate, high fat diet influences the development of insulin resistance?
Yeah, I have to
Well,
say,
hang on. Hang on. I don't think low carb, high fat diets cause insulin resistance. So this is interesting. It's like how often do you do something bad? Well, no, it doesn't do anything bad. But this is, I guess they already are kind of in agreement that something that I recommend, a low carb, high fat diet, causes insulin resistance. Well, I did a video on this, how sometimes it can be misunderstood because there's a lag time in responding to blood glucose. But I don't think that's what they're trying to talk about. Let's keep going.
I'm really kind of troubled by this, that we're seeing a whole lot of periodic enthusiasm for a low carbohydrate diet. It started with Atkins and
Well,
then it kind of died out and then came back to South Beach. And it's,
let me just say, in fact, I think I've known Dr. Barnard since Dr. Atkins died in 2003. And the reason why a low carb diet keeps coming back is that it's useful and that it's, thinking back on the podiums that I've shared with Dr. Barnard, it seems like he thinks that all approaches have to have the same mechanism and that there only can be one good way to go about things. I don't think that at all. I think there are a lot of different ways to improve things. And so they're coming in, and this has been kind of Dr. Barnard's brand, if you will, to say ours is the best way. Everyone else's way is not the best, and even though you really can't say that until you study diets directly head to head in clinical studies. But I'm still kind of curious why they think low carb, high fat diets cause insulin resistance when I see the exact opposite in my practice. Maybe we can figure that out.
died out and they came back as ketogenic diets. And when these low carbohydrate diets recur, you can sort of understand why that would be the case, because people have high blood sugars and they figure if I stop eating sugar and carbohydrates that turn to sugar, my blood sugar will fall, and it does. But you're not really attacking the source of the issue, which is the buildup of fat inside muscle cells and inside liver cells. So now when people go on low...
I see. So the mainstream kind of let's not worry about what people eat approach is to let's just look inside the cell. And we can maybe figure out what causes diabetes, regardless of what someone's eating. And I have to agree that there's fat deposition inside the cells, but that goes away on a low-carb, high-fat diet. It's fascinating how when someone sees fat in the body, they assume that it's fat in the food, when actually the carbohydrate in insulin is the fattening hormone. So fatty liver is actually from carbohydrate in the food because the insulin is telling the liver to make fat out of the carbohydrate. So I see. So if it's a fatty liver or fat in the muscle causing insulin resistance, I think that's what's observed when you eat carbohydrates and you see insulin resistance. But that gets better on a low carb, high fat diet because of all the metabolic change. And it just kind of strikes me again why Dr. Barnard is being being interviewed for research or understanding about low carb diets when he hasn't studied them and really has only been kind of a critic of them without studying them. So there's a lot of keyhole views. In fact, I think he even goes to the point of saying, since people with diabetes have heart disease, they need a low-fat diet because we know low-fat diets reduce heart disease. Well, no, it's actually been shown that low-fat diets don't reduce heart disease. But that was the teaching back in the 1990s. Good Calories, Bad Calories, a book by Gary Taubes, was really influential for me because it showed how that kind of improper inference was made without solid science. So back then, diabetics, they get heart disease, and we know low-fat diets fix heart disease. Therefore, people with diabetes should have low-fat, high-carb diets so they don't get heart disease. Well, it really hasn't fixed the problem. People with type 2 diabetes are just put on more medicine and medicine. So, well, let's continue and see what else Dr. Barnard says.
carbohydrate diets, because carbohydrates are what, 50 or 60% of what a person eats. I'm talking about all your fruits and beans and whole grains and so forth. So,
Well, that's not what I eat. So, assuming again that everyone eats carbohydrates, well, doesn't mean you have to. And again, it's like apples and oranges in terms of different approaches. They're all fruits, and they're just different kinds. There are different kinds of diets that work in different ways.
starchy vegetables. If you take all that away, you are eliminating a lot of calories that people will lose weight. And if they lose weight, they're going to lose some body fat. And if they lose enough fat, you will sometimes see their glycemic numbers improving, that their A1C might come down and so forth. The problem, well, there are many problems, but from my standpoint, the biggest problems that we are left with is that the foods that remain in the diet are meats, gravy, foods that tend to cause cholesterol to rise. And the reason that's such a problem is that what's going to kill a person with diabetes, in most cases, is vascular disease. Their blood vessels are being attacked, their heart is being attacked, the tiny blood vessels to their eyes or the tiny blood vessels in their kidneys are being attacked by this disease. So you don't want to raise cholesterol levels. You don't want cholesterol in your diet at all. And there have been a couple of recent studies.
So again, this is kind of the, let's do a low-fat diet for everyone. It'll keep the cholesterol down and everyone will be healthy and happy. You know, it works for some people, but most of my patients are unable to do a low-fat diet, and they have diabetes, and a low-carb diet works really well. We're in agreement there's too much fat in the muscle, which is one of the issues in insulin resistance. We're in disagreement about the tactic on how to fix the insulin resistance. My method is to start with stopping the carbohydrate in the food, and it all gets better downstream like that. So thank you, Dr. Barnard, and thank you for sending me the video to watch. I see he still hasn't changed much in the last 20 years since I first met him. If you've seen anything else that you want me to react to, let me know and put it in the comments below. This video, be sure to like, subscribe, and hit the notification bell, and check out AdaptYourLifeAcademy.com.